So definitely, it seems that clear, ongoing communication with your entire clinical team and your equipment provider and everybody else is really the key to living well with oxygen therapy. Do you have any other words of advice for people on how to work with their care providers and everybody else to really monitor their health and their ongoing oxygen needs?
I think we've covered a lot. I really think the support piece is important. In our support group, I'll find patients exchanging tips on how they manage to not trip over their tubing at home, or how they have, found a better setup for a backpack. And I really think that sharing and support with others that use oxygen, as well as your care team, it really makes a difference. Pulmonary rehab, of course, I can't say enough about it. That really provides a support and education. But we really want patients out and about on oxygen. We are advocating with ATS and COPD and PFF, all the foundations, very hard to keep our patients who are on oxygen, to keep them living life, traveling, visiting friends, going to religious services, working. We really want to support mobility. So anything we can do and anything patients can do to get support from each other to get out in the world and still enjoy as much as they can. Everybody has different limitations. But I would say whatever you can do to get support with other people on oxygen, and just whatever you can do to get out of the house and stay mobile, exercising, anything that you can do. So I really think that support with other patients, families, and your clinician care team is critical to kind of successful living with oxygen.
Great words of wisdom for anybody using oxygen therapy. So Susan Jacobs, registered nurse with the American Thoracic Society, thank you so much for sharing your knowledge and expertise with us today. I'm sure we're going to make a lot of differences out there in people's lives.
Oh, thanks very much, Mike, for having me.